Hey guys, welcome back to another issue, another chapter, another episode of W.D.Y.D. CSP. What do you do as a central sterile processing technician? Guys, so last week I kind of covered um, the similarities and the differences between the two certifying bodies and what it takes to become certified. And today this episode, I want to cover chapters 2 and 3 because chapter 1 on both editions is basically an introduction to sterile processing. Chapters 2 and 3 differ a little bit, so I'm just going to go off of how I think it should go, I guess. Um, just to let you know, chapters 2 and 3 in the issue manual is anatomy and physiology and medical terminology, which I believe go hand in hand. You can't speak of one without knowing the other because you'll be lost. Chapters 2 and 3 of the CBSPD is anatomy, physiology, and microbiology. Isham covers that in a later chapter, and I think we'll go into that. So I just want to go hand in hand with that. But before I do that, I will say that if you read the books and the chapters that are dedicated to terminology and anatomy, it would be enough to pass the exam and put you in the right track to knowing a lot of the instrumentation, a lot of usages for instruments, and what sets are created for. But I will say, I dwell deeper into the subject, and like I said, I started my career off as a surgical tech. So it was a little bit more important, and I'm not going to say more important, it's just just as critical to know medical terminology and anatomy as a surgical tech. Because as things are going on in the operating room and terminology is thrown around, it kind of can get a little confusing if you don't know what you're talking about. So I do suggest that you pick up a medical terminology book. I don't think you can find this anymore. This was issued to me, and it's still brand spanking new, guys, because I rarely wear my books out. But this one is one made by Saunders. I'm not sure when this was made, but I can tell you right now, I got this when I was a surgical tech. So this was published 2009. So this book is 11 years old. But a lot of the terminology still applies here. I like this book because if you can tell right here, it's kind of color coded. And it breaks down terminology with anatomy, prefixes, the root word, the body systems it goes over, suffixes of the medical terminology, and a lot of that's important, guys, because when you talk about anatomy and physiology and you talk about medical terminology, a lot of the words you can pick up what it is like right off the bat. Like if you think about laparoscopic instrumentation or laparotomies, if you know that the prefix is lapra, you know it's dealing with the abdominal area. So any instrumentation that is named after, like laparoscopy or laparoscopes, you know that it is dealing with examination or anything dealing with the abdomen. Um, not all instrumentation has I believe, a medical terminology attached to it, but I will use a hemostat for an example. Okay, if you break down the word hemostat, hemo meaning blood, stat meaning stop, quick, immediate, alert, fast. So hemostat, if you really think about the word, it's blood fast. So this instrumentation is used to stop bleeding fast. So hemostats, when you think about any hemostats, it's to oculate or stop bleeding. Okay, that is the terminology behind it. And if you know your medical terminology, seeing instrumentations like this and listening and looking at the words and the actual definition of the instrument, you'll be like, oh, I know what that's used for. And why is that important? Um, I will tell you the importance of it, and people, I don't need to know all that. I just need to know that, it's a metal instrument, and it's used in surgery. Well, not always true, because if you know what the instrument is used for, you kind of get an idea of the soil level that this can accumulate. So, being that these are hemostats, you know that they deal directly with blood. Yeah, they can be used to oculate some bile and stuff like that, but you usually don't use a lot of pressure when oculating bowels and stuff like that, because you don't want to cut into it. But if you know that this is dealing with blood, then that's the type of soil that you are targeting or you're trying to combat. So when you're inspecting your instrumentation, that is what you're looking for. As with if you're looking for instruments that deal with bones, so osteo is the prefix for bone, osteo. So tomes, osteotomes, it's cutting into bones. Um, you know that you're looking for bone fragments. So I wanted to kind of touch bases with that, because if you think about your medical terminology, I'm going to refer to, actually, I'm going to leave this book alone because it's a little bit more detailed. I'm going to refer to the chapters in the book itself. So if we're talking about, let's see, let me turn to these chapters here. Sorry, guys, that I'm a little off here. But let's discuss how the book breaks down medical terminology. So they tell you about the importance, understanding the operating room, the quality of service to patients with knowing it, and anatomy of medical terminology. So certain words, all words are broken up with prefix, roots, and suffix. Okay, the main word, and the suffix. The root word tells you the primary meaning of the medical term. Okay, the prefix comes before the root. Okay, before, suffix after. Okay, and it's a modifier. It basically modifies the meaning of the word. The suffix of many words tells you, and it comes after the root. Okay, and when added to the root, it says here, when added to the root at the end of the word, can alter or modify its meaning. Okay, the example they give you, for example, the medical term for the suffix that means inflammation is itis. Okay, that's the example they give you. Okay, so when they give you a term of pericarditis, okay, cardi means the heart, peri, okay, it means the inflammation around periperipheral. If you think about it, if you think of other words, you kind of get it, okay, and around the heart. So inflammation around the heart, okay. So the book is broken down with sections here that gives you prefixes to a lot of the words, okay? A lot of them that we will encounter, the common ones. Again, the book is to dwell deeper into medical terminology, but when you deal with medical terms, again, you want to know these prefixes because they're important, okay? Prefixes such as hemi, meaning half, okay? Para, besides, okay? Septo, dividing, like septoplasty, okay? That means divide the walls, and plasty means construction or fixing the walls, okay? Chole, electro, words, okay? Other prefixes that you might encounter that they have in here. Let's see. Okay, so this is the biggest breakdown here. So bi, hemi, para, peri, post, trans, neo, sub, supra, extra, hyper. Okay, those are all your prefixes. Okay, your roots, arthro. Okay, things like that. Medical terminology wise, arthro, joints, gastro is your stomach. Okay, colo is the colon. Okay, rhino. Okay, think of a rhino, the animal is the nose. Okay, cyst. Okay, people, the cyst, fluid-filled sac. Cardio is the heart. Some of the ones that most people wouldn't think about, encephalo. Okay, that's the brain. Other other root words that people are not familiar with, okay, is derma, okay, the skin, okay, dermatology, um, hepato, which is the liver, okay, nephros, the kidneys, okay, nephratic, you think of it, nephro, I never knew what nephro was when I started this. Um, Okay. Uh, Let me see. Mast. Mast is another root word which is designated for the breast. Stoma is an opening. Okay. So these words can be tricky from time, but as you start hearing them over and over again, they become very familiar. One of the ones that you really want to pay attention to is those otomy, ectomies, ostomy, things of those. Those are the ones that you're going to see a lot of. Okay, ostomy, like if you see a word with the ending ostomy, the suffix. Okay, ostomy is making an opening, as otomy is an incision into an organ. Okay, an ectomy is a removal. Okay, so a lot of those times those medical prefixes, I'm sorry, suffixes get confused with medical terminology. So when you're looking at a word, be careful to make sure that the otomy isn't an ectomy. Okay. A lot of times people confuse those words, or they'll see something and be like, "Oh, they're removing something." No, they're actually cutting into. Okay, like an osteotomy. Okay, osteotomy is cutting into a bone, as an osteoectomy is the removal of bone. Okay, um, ostomy again, otomy, and then you got ostomy. Okay, os is um, creating an opening. So a lot of that time is you do that with bile. Okay, it's like a coleostomy. Okay, it's actually making an outside opening to the colon that is accessible to that. So if you see somebody with an ostomy bag, okay, they are actually their bile is actually being diverted outside the body. Okay. Um, so, how does this apply to anatomy and physiology? Again, with anatomy and physiology, which is the next chapter in the Isham manual. Okay, let's go into that. A lot of those suffixes, prefixes, a lot of those medical terminologies are into or are translated into um, the anatomy of the body. So if we're talking about bone, okay, the periosteum, okay, if you know peri, it means the surrounding. Osteum is the bone itself. So periosteum is a lining of the outside of the bone. So knowing that it's really, really important. When they're talking about arthritis, inflammation of the joints, okay, that's talking about anatomy. The other thing that you want to think about when you're talking about anatomy is positioning of the patient. So a lot of times in central processing, we go in and um, our volume in central processing is dictated by what's going on in the operating suite or in the clinical suite. So if you go in and you're looking at the um, schedule board, okay, and you see that they're doing a spinal case and they're talking about anterior and posterior lumbar resection or lumbar fusion or herniated disc repair, um, anterior, posterior. Another dealing with anatomy is distal and peripheral. You're talking about frontal, superior, anterior. Those are all terminologies that deal with positioning of a patient. Um, so when you're looking at instrumentation, okay, that applies as well. The anatomy of a instrument also plays part as with an anatomy of a body, okay? If you're talking about the distal tip of an instrument, is the tip furthest away from you, okay? So inspect the distal tip of your instrument. If you're talking about uh, 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 the anterior posterior, okay, For instrumentation, really not too much, but for body parts, if somebody is getting an anterior spinal resection, okay, um, they're going through the front of the body to get to the spine to remove. A resection is a removal. Okay, so you know that when your instrumentation that you're dealing with is, you're going to be dealing with longer instrumentation, and it might get bloodier. There might be more soil because they have to go deeper into the body to get to the spine. Posterior, okay, post is behind, okay, posterior of the body is the back. So the spine is right there. Not much to get to, small incisions, you're right there in the spine. But you're going to be dealing with bone as well. You're still going to be dealing with some blood. So it kind of gives you an idea of the type of instrumentation that may be needed or required. So if you're going into the anterior portion of the body to get to the spine, you need longer instrumentation. When you're going in anterior, I'm sorry, when you're going to the posterior view of the body to get to the spine, you might be using shorter instrumentation. Um, okay, supinated or pronated means, you know, if the person is upright or upside down. Those are medical terminologies that you really need to know. Um, as far as with the anatomy, you should know the parts of the body. You should know the systems of the body, such as the cardiovascular system, the augmentary system, the urinary tract. All that plays a part in how you um, perceive or know the soils that you're dealing with. It also ties into microbiology, and we'll talk about that later on. Um, so chapters 2 and 3 of both manuals dwell heavily. Not really big chapters. I will say that the medical terminology chapter is probably bigger than the anatomy chapter. The anatomy chapter talks a lot about the systems of the body and how many there are. You'll also see this in a medical book as well. So if you're looking at body systems, it is really important to know your body systems. And there are, I believe, 11. Let me confirm that. Let's see. There's two, four, 6, 8, 10, 11. Yes, there are 11 body systems. If you take the reproductive system and combine it into one, male and female, then you're only talking about 10. But they usually separate the two because the two are quite different. But you're talking about the 11 body systems. Um, uh, Digestive system, and to name them all, let's name them all. I'm sorry. You're talking about the cardiovascular system, you're talking about the digestive system, the endocrine system, the female reproductive system, the lymphatic system, the male reproductive system, the muscular system, nervous system, respiratory system, urinary tract system, and the skin and sensory organs. Okay, largest little fact: the largest system in the body is the skin, which is the augmentary system. That is the terminology for the skin. Uh, but it is important to know them because, again, when you're dealing with instrumentation, again, if you're doing a skin closure, okay, you have to know what kind of instrumentation they need for that. The instrumentation type, if it's traumatic or atraumatic, determines on what type of tissue that you're dealing with. You don't want to use a traumatic instrument on a very delicate tissue. You want to use an atraumatic being not trauma, okay, A being the not and trauma, okay, traumatic meaning causing harm, and then traumatic meaning causing harm and causing damage, okay, trauma, that's the trauma ward, trauma patients, trauma instrumentation. So when you're talking about if it's a serrated or non-serrated instrumentation with teeth or without teeth, you can give the terminology of traumatic or atraumatic. So really important chapters to hit. I will admit that when I took both exams, not much was stated with medical terminology or anatomy. It wasn't too much in there, but there was when I took the central sterile, the instrument specialists. There were questions in there pertaining to anatomy. So they would show me an instrument and tell me what part of the body would this be used on. That's when you need to know your anatomy. So don't skimp on that chapter. A lot of people who study this, they study the sterilization part of it or the decontamination part of it. And those are really heavily looked at on the exam, and they weigh heavy on the exam. But knowing the terminology helps you with those chapters, guys. I can't stress that enough. The medical terminology is really important because the understanding of what we do and why we do. I've always said the reason that I made this channel was to explain to you why you do what you do. Don't just do it. Okay, I can just sit here and tell you, hey, son, you can grab this instrumentation. If it's dirty, go ahead and clean it and do whatever you want. But there's a rhyme and reason by the way we clean it, how the IFU states that we clean it, and the reason for this instrumentation to even exist. And if you do not know your medical terminology, you do not know your anatomy, a lot of this stuff is going to sound so alienated to you. And that's not what you want. If you want to go in as a basic tech, okay, that's fine. But you're always going to be basic, okay? Always reach for the stars. Always look to move past the basic and becoming the expert, because until then you would always be looked at as just a central processing technician, nothing else, nothing more. If you don't know, I know individuals in this field that's been here forever and basic is all they did. And did they get by? Yes, they did. Did they excel anywhere? No. I always look to excel, to stand above and beyond my peers. Do I see myself as an equal? Yes, I do. But I would like to be, I enjoy being the subject matter expert. I love when new challenges come in and I can troubleshoot them because I've done my homework. I've read deeper into the books. I've looked at all the resources, and I continue to educate myself, not just, hey, I passed it, this is going to collect dust. I might have read this book. I've read this one for the first time because I just got it. I passed this exam with this book. But I must have read this book probably, I'm going to say about 10 times. I've been in this field for 10 years, and I probably read it 10 times, and I continue to read it. Because there's always something in here that you want to learn, something that I've forgotten, something that I didn't memorize, a bacteria that I, long forgotten. And I'm like, wait a minute, I've heard that bacteria somewhere before. Where did I hear it at? And I look in here and I find it. Or a terminology that I've never came across. And I'm like, wow, just like the other day I looked at, and here's a story, I looked at a surgery one day and I'm looking at the surgery and I'm like, wow, okay, I see what there. I identified the suffix. I just couldn't identify the root and the prefix. And I'm like, is this a made-up word? Is this something new? And I was like, wow, what is that? And I'm looking in and actually, something, I'm gonna look it up again real quick for you guys. I'm gonna look it up because I was like, wait a minute, this thing. And I'm gonna look in this book because I think this one probably has what I want in here. And I was like, I couldn't identify the surgery. I didn't have a clue what it was. And I'm hoping I find that in here because I was stunned by the surgery. And I was like, wow. And honestly, I don't see it in here. I really don't. I really don't see it in here. And it's funny because I was like, look, I'm going to look this thing up. I'm going to find this surgery and find out what it is. And I think I have to go back, honestly, and look at that word again because it was one that I couldn't identify. I really did. And it stuck in my head for a little bit. And I said, I'm going to look this up to see if I find it. And a lot of times, sometimes there's a spell. There are spellings on there that are incorrect when they put them up on the board. But for the most part, they're pretty good. That's the other thing that I'm sorry, I'm all over the place, guys, but this is live. This is like not edited. I don't edit my videos. I tell you how it is and the truth. But that's another thing that you want to pay close attention to when you're looking at your medical terminology is the acronyms and the abbreviations for a lot of medical surgical procedures, like triple A's and ACLs, LMPs, LNDs, ORIF. A lot of those terminologies float around in there, and they're really important to know. DNCs, the GABAs. I'm not going to go into each one of them one by one, but you guys need to pay close attention to them, because a lot of our instrumentation sets have these abbreviations in there, like a AAA set or MIS set, or a AV fistula set, ALIF or ORIF surgery, you know, let's see what else. What we got? A T. Oh yeah, this is a common one. A TURP set. Okay. A lot of those sets are named after VP Shunt. So pay close attention to that when you get to that chapter. Read it carefully. Jot down some notes. Memorize a lot of those prefixes and suffixes. And those words come together very easily. Guys, as always, thank you for watching. Stay true to yourselves. Keep it 100 and keep pushing forward, guys. I will see you next time when we'll cover microbiology and medical terminology a little bit more. All right, guys, as always, stay true to yourselves. As I said, peace. Take care. See you guys again.